today's conversation, and we'll be able to share those out with you. So just a few logistics. I'm hoping everyone can see my screen. Yes? Great. Upon entry, just mute your microphone. We will at some point be open for questions, and at that point we'd ask you to unmute. So on the bottom left is where you mute and unmute. I know some of these are repeat because now it's 11 months that we've been using Zoom or another video type platform. Please, as a reminder, drop your name and organization in the chat box. Of course, we know that removing all distractions is a challenge these times, but asking for full attention to Lisa when she gets started. It's lunchtime, so grab a bite or a beverage. You can take notes, of course, and we will try to drop the slide deck into the chat or share it later. And of course, we are trying some new tools today, so thank you for your patience. Many of you are aware that we have launched our Staten Island Stay Strong, Stay Safe campaign. I don't know if the link looks a little odd there on the deck. It shouldn't look like that. We'll drop the link in the chat box. We are encouraging all of our Staten Island partners, individuals, families, neighbors, school students, anyone to join our campaign to help spread awareness of how to prevent COVID-19 from spreading in our borough. That includes ways to share PSAs and flyers in this toolkit, messaging and text in your newsletter, as well as social media posts, specifically asking you to use the hashtag SI Stay Strong, Stay Safe. And as we've moved into vaccine rollout, we're also trying to get PSAs, either videos or photos of you with, we have a flyer we'll put up at the end of the presentation on why you're getting vaccinated. If you do, or when you do speak, just say your name and organization. We're asking you to just, if you are sharing your screen, describe graphics. We are asking people to let us know if at any point you're unfamiliar with terminology or language that is used. While Lisa is speaking, feel free to drop it in the chat, and one of our team members will make sure to pass that along to Lisa. Again, this is a little bit of a repeat, but if you'd like to stop your video for any reason, you can do it at the bottom, same with mute. To see the transcript or the closed captions, like I mentioned at the top left, you'll see a red button that says live. You can click that to see a separate window pop up with the transcript, and of course get closed caption on the bottom of your screen by hitting the closed caption tab. This is a little bit redundant. If you'd like to just see the speaker, and in this case, Lisa, while you're enjoying her presentation, you can select speaker view from the upper right corner of your window. And in the center, click side-by-side mode, and then you'll be able to see just her and her slides. Real quick, because I know we have some new people joining us today. This is hosted by the Staten Island Not-for-Profit Association and our community organizations Active in Disaster Coalition. SINFPA, as it's called for short, was formed in 2005, and it was really developed to help build the capacity and provide education, training, and resources for the borough's nonprofit sector. And that includes a wide range of organizations from arts and culture, health and human services, to education and more. We do also provide a single voice for nonprofits across the island to be heard beyond our borough. It's a lot of text here, but in brief, hopefully many of you have heard about the coalition by now. We've been very activated during COVID-19 for the past 11 months, working with our community-based and healthcare and medical institutions, particularly through the medical ecosystem, and an incident command team that we've set up in partnership with Staten Island Borough President's Office. And we've been providing situational awareness, doing needs assessment, and really helping to get information and resources out to our community organizations and communities throughout this time. So that's everything from supplies to discussing staffing and surge with our medical institutions, and now, of course, being involved in vaccine rollout. So this is at the end of our presentation, we'll talk a little bit, but in case anyone jumps off, please make a note of our Staten Island Stay Strong, Stay Safe campaign, and do join us. You'll see links in the chat to come, and at the end, we'll talk about some of our other upcoming events. At this point, I would like to invite Lisa to start sharing her screen, and I'm going to let her take it over from here. Lisa's bio was in all the materials that we've shared, and I know we have a lot to cover, so I'm not going to share too much about her extremely amazing credentials, but she has been a wonderful partner to SINFPA. This is the second or third presentation she's done with us through COVID. She and her team at Perlman are an incredible resource for nonprofit organizations throughout the city and beyond. If you're not already signed up for their newsletters, or check out their website, check out their social media. They put out briefs and alerts that I have found extremely helpful. And so we are just honored that Lisa is here to share with us, should you and can you require workers to get the COVID-19 vaccination, what you all need to know. Thank you, Lisa, for being here.
Thank you, Sharmila, for having me. I'm delighted to be here. Welcome, everyone. Good afternoon. I hope that I will be able to answer your questions. And I know this is a pressing issue. At the same time, you may have heard the mayor just announced that the city-run vaccination centers are holding off scheduling appointments until there is a resupply. So you'll be ahead of the curve in addressing this issue right now, because it's going to be a while before many of your employees will be able to get the vaccine at all, except for those who may have already gotten them in healthcare, or those who are over the age of 65. So we'll talk about, may employers mandate it? Should they administer the vaccine themselves? And some takeaways and tips to help minimize legal risks. So you may have heard the Equal Employment Opportunity Commission, which is a federal agency that enforces the Americans with Disabilities Act, Title VII of the Civil Rights Act of 1964, and GINA, the Genetic Information Non-Discrimination Act. That agency that enforces those laws provided guidance updated guidance essentially on COVID-19, on the pandemic, and on the laws it enforces, and how how issues around that affect the laws that they enforce. So in this updated guidance, the EEOC, and I want to point out this is guidance. What I'm going to be talking to you about is federal guidance and not laws, not case law guidance that courts can take or not accept. But since this is the agency that enforces those laws, the court will often give deference to it, but it is guidance, it's not the law. So the EEOC has said that the COVID-19 vaccine is not a medical examination under the Americans with Disabilities Act. And as a result, employers have some more leeway and generally may mandate the vaccine, however, with a few exceptions. The employers that are seeking to mandate the vaccine have to provide exceptions for employees that may have medical conditions or sincerely held religious beliefs. So what I mean by medical conditions is, let's say an employee will have some type of severe allergic reaction to the vaccination. We've heard a few instances in the news about it. And so if that's the situation, that under the Americans with Disabilities Act, the employers would have to provide exemptions. We're going to talk a little bit more about that, and reasonable accommodations. So if the employee objects to a mandatory vaccine, then the employer has to conduct an individualized assessment about whether that unvaccinated employee poses a direct threat due to significant or substantial harm to the health or safety of that person or others that cannot be eliminated or reduced by a reasonable accommodation. So the individualized assessment would look at, in determining whether there's a direct threat, how long the risk would be, the nature and severity of the potential harm, the likelihood that the potential harm will occur, and the imminence of the potential harm. So of course, in a situation where your employee is directly interacting with others, the likelihood of a direct threat is greater than it would be if they're not interacting directly and closely with others. So what you want to look at is what is the reasonable accommodation that can be made? Is there a reasonable accommodation that can be made to this individual without posing an undue hardship that would eliminate or reduce the risk so that the unvaccinated employee does not pose a direct threat? So consider what the reasonable accommodation might be for this individual. It could be, for instance, essentially you're going to enter into an interactive dialogue with this employee to determine a reasonable accommodation. It could be that the employee works remotely. It could be that you're implementing certain safeguards and measures in the workplace, including continued mask wearing and social distancing, or different types of plexiglass barriers that would provide a reasonable accommodation to the individual who is not getting vaccinated due to a medical condition. And considering whether providing a reasonable accommodation would pose an undue hardship. That's a very high standard in New York City to meet. So we'll talk a little bit more about that. The employee might provide, documentation of their need for the accommodation, whether it's the need to be working from home or whatever the accommodation might be. And employers have a legal obligation to engage in a good faith interactive process. So you're not going to shut down the conversation when someone says, I can't do this, or I'm not going to do this. You have to engage in cooperative dialogue. You document whether you've granted or denied the request for an accommodation, and really demonstrate that you've engaged in this process. One way that the New York City Commission on Human Rights has said that employers can meet their obligation to enter into a cooperative dialogue is to let their employees know about what the process is for applying for a reasonable accommodation. You have a policy that addresses it. You remind your employees, we have a policy if somebody needs a reasonable accommodation for a medical condition or sincerely held religious belief or pregnancy. Here's what our policy is, and come see so-and-so at our organization if you need a reasonable accommodation. So you engage in this process to determine a reasonable accommodation or to determine whether no accommodation would eliminate a direct threat to that person or themselves. In response to the EEOC issuing this updated guidance, New York City Commission on Human Rights recently updated its own guidance in connection with COVID, which you can find on its website. And they reiterated that employers have an ongoing duty to provide employees with reasonable accommodations based on pregnancy, religion, or disabilities, including disabilities related to COVID, unless doing that would pose an undue hardship, or in the case of a request for accommodation based on disability where the person presents a direct threat that cannot be adequately mitigated by a reasonable accommodation. They have essentially they adopted much of the EEOC's recent guidance on this particular issue about the COVID vaccine, but noted that there's one area where New York City law differs from the Americans with Disabilities Act, and that is that New York City actually requires the employer to initiate the reasonable accommodation process if they know or should know of a disability, pregnancy, religious beliefs. So they also noted that COVID-19, that the pandemic qualifies as direct threat to health in the workplace, and as you probably already know, employers can, take tests, take temperatures and things like that to ensure that an employee isn't coming into the workplace and spreading COVID. So I mentioned a few, possible reasonable accommodations. It's going to be up to you and your employee to discuss what accommodations would be reasonable to accommodate the person's disability, religious practice, pregnancy. But I mentioned a few of those. As I mentioned, the standard for showing that providing reasonable accommodation under New York City law is an undue hardship is a high standard to meet. And so I encourage you to work to find a solution, to find an accommodation if this issue comes up. The undue hardship standard for religious belief is where the accommodation would require significant expense or difficulty to the organization. And I'm focusing on the New York City human rights law because it is more employee protective than Title VII of the Civil Rights Act of 1964, which is the law that prohibits, the federal law that prohibits religious discrimination for employers that have 15 or more employees. So a religious accommodation is deemed to pose an undue hardship if it will result in the inability of an employee to perform the essential functions of the job. And there are certain things that you would need to consider in determining or concluding that providing a reasonable accommodation based on sincerely held religious beliefs is an undue hardship. So another question that I've gotten is, can we ask the employee to provide us proof that they got the vaccine? And the EEOC has said in its guidance that an employer may ask for proof that the employee has gotten the vaccine once we get to that point, but you would be, well advised not to instruct that employee. Please do not provide us with any medical or genetic information. We just want to know that you've gotten the vaccine, or just something showing us that you got the vaccine. Do not provide us any other medical information or family history information. That's what I'm referring to when I talk about genetic information. You may not ask an employee why they did not get the vaccine, because that may open up, that may elicit a response that gets into a disability that the person has. But you may ask them to provide you with proof that they did get the vaccine. The EEOC has said in their guidance that a receipt of having gotten a vaccine is not a medical exam. It's not an impermissible disability related inquiry, but follow-up questions after that may be a disability related inquiry, and in that case you have to tread very carefully. So there are some things to think about. Switching now to the question of, well, are you an organization that can or is considering administering the vaccination yourself? Do you have a licensed healthcare provider who would administer? I mean, you would need a licensed healthcare provider, someone who's licensed to do that, to administer the vaccine. Are you going to do that? I would say think twice about doing that. It may come with more potential risks than benefits, and it might just be a better course of action to encourage employees to go get the vaccine once it's available at a city site. Hopefully, eventually our pharmacies will be carrying it, CVS or Walgreens, and employees will be able to go there. But potentially, if an employer insisted on vaccinating its employees, and then there was some type of reaction, severe reaction that the employee had, they might potentially claim, assert a workers' comp claim that arose out of the course of their employment. You would have to be sure that if you were mandating this vaccine and you were then administering it, that the pre-screening questions, you would have to make sure that doesn't reveal medical or genetic conditions. The EEOC has said that if an employer offered the vaccine voluntarily, and employees could choose whether or not to take the vaccine, then there wouldn't be an issue from the perspective of the Americans with Disabilities Act of asking pre-screening questions. But if you're mandating it, then asking those pre-screening questions may be potentially problematic because they may lead to a person then disclosing information about a disability. And then the other thing, is that if you were to administer a vaccine, you would want to do it in accordance with whatever the public health guidance is about the order in which, or the prioritization of which, of who gets the vaccine first. The New York City Commission on Human Rights has said that it's fine to, if the priority that the public health agency has said, look, we're taking people who are older, who are 65 and older, then the City Commission on Human Rights has said, that's fine. You're not running afoul of discrimination laws by preferring people who are, or prioritizing people who are age 65 and older, because the public health agency has said those folks go first. However, I will say, in terms of minimizing the potential for discrimination claims, be aware that if you just decided that you're going to give vaccines, you want to make sure that you're doing that in a non-discriminatory manner. If an employer exhibits favoritism in any way as to who is going to get the vaccine first, that could potentially raise discrimination claims. So just be mindful of that. And you'll have, if you were to administer the vaccine, you would have other obligations. You would have to register with the state and upload certain records. And, we've heard about the refrigeration issues and storage of it. There are potentially data privacy issues, depending on what information you're collecting, if you're collecting medical information. So, in a abbreviated way, you might be better off considering, we're not going to administer it. We're going to have the employee go to a third party and get that vaccination, or contract with a third party to handle the administration of it. Okay, so we talked about some of those things. You have to make sure that you're complying with whatever the state health department requirements are if you were to administer the vaccine. You would have to make sure that any pre-screening questions are job-related and consistent with business necessity, where you are mandating, if you are mandating the vaccine. So there are a number of considerations if you're deciding to do that. As I mentioned, if you're voluntarily administering the vaccine and the employee has a choice of whether or not they're going to get the vaccine, and they choose to get it, and then you're asking them some pre-screening questions, which you ordinarily would, then those do not need to be job-related and consistent with business necessity to comply with the Americans with Disabilities Act. And as you all know, there's a legal obligation to keep any medical information confidential. So I did want to ask you, I know, it is a little premature because of the mayor's announcement today that there aren't going to be any more vaccines administered until there's a resupply, but hopefully soon enough, the states will start getting more, and people will be able to get more vaccinations. So my question for you is, does your organization plan to mandate those vaccinations once they do become available? I'm interested to hear what the group has to say on that.
Lisa, can you see the poll and the results popping in on your screen?
Oh, okay, there we go. So we have, okay, so I'm going to share that with everyone. 84% of you said no, you will not be mandating it.
There's a few more coming in. I think we're almost, I think we'll,
oh, okay.
So you can go ahead.
Sorry, I shouldn't have said anything.
No, that's okay. They're almost at they're almost,
the poll.
I think you can go ahead. This is, looks like an overwhelming response for one direction.
Okay, so 86% said no, and the balance said yes. And I would also say, what I'm seeing is that right now is consistent with what I'm seeing, which is that employers are encouraging employees to get vaccinated. I'm gonna go to the next question, and then I'll share a little bit more about what I'm seeing. So my next question is, if you plan to provide an incentive to encourage employees to get the vaccine, what incentives, if any, are you planning to use?
Hold on 1 second. Linda, are you doing this right now? I wasn't sure.
No, I just need to click out of it. Sorry.
Okay, hold on 1 second.
You want me to just close out of that?
Go back. No, actually, hold on. Go back to the previous slide for 1 sec. The first polling question, if you don't mind. The slide. Can you go back to the slide, Lisa?
Yeah, I'm trying to.
Okay, that's all right. For those that had trouble seeing it, do you see the poll on your screen right now? Hopefully you'll see the next one. Okay, we'll try the next question, and hopefully those that couldn't see the first one could see the next one.
Oh, they couldn't see the first question.
Yeah. Okay. And I don't know if you're on the phone, because if you're on the phone, you might not be able to see it. Is anyone else having, I mean, we had. Okay. All right. So let's go to
should I stop the share results on that? Everyone can see that now? They can see the results.
Yeah, and you can go to the next one now. Okay.
Okay, so my next question is, if you're planning to provide an incentive to your employees, what type of incentive are you planning to provide? We've heard that companies like Target and Dollar General and others have offered paid time off and other types of incentives to employees to encourage them to get vaccinated. Okay, so unanimously, for those who are offering an incentive, oh wait, I don't want to say that. I don't want to say, because we're still not fully polled. I'll hold on.
Yeah, let's wait, give him a few minutes. For those that had trouble, I'm hoping you can see this second polling question here. You're welcome to drop your answers into the chat as well. The question is on the slide on the screen. If your organization plans to provide an incentive to encourage employees to get the vaccine, what incentives are you planning to use? And if there are others, aside from paid time off to get the vaccine or a gift card, please drop them into the chat box so we can get a sense of what you're thinking about. About halfway there. So, and like I said, if you can't get the poll, feel free to drop your thoughts in the chat box.
We're still about a little less than half have responded to the poll, so I want to make sure everybody can see it, and then once we have the results, I'll let you know.
Hi, Lisa. Linda speaking. Just letting you know, also in the chat, they've said that they're not planning on incentives, and Lisa said, I had not considered this. We are not planning on incentives at this time.
Okay.
So we might be at the max responses at this point.
Okay, yeah, so it looks like not everyone has responded, but the majority, at least of those that did respond, said that they're planning to provide paid time off to get the vaccination. And we've seen, as I mentioned, some companies, for-profit sector, providing, offering paid time off for that as well. So it's something also to consider if you haven't thought about it, whether you might want to do that. So we talked about Title VII of the Civil Rights Act of 1964 that deals with religious, provides protection for employees from religious discrimination. We talked about the Americans with Disabilities Act. We talked about GINA, but there are other laws that come into play here, and one is OSHA and the agency that enforces the Occupational Safety and Health Act, the federal agency, says that employers have a general duty to provide a workplace that's free from recognized hazards that are causing or likely to cause death or serious physical harm to employees. So, you know, employers are caught in a little bit between a rock and a hard place. You know, in theory, there could be, if the employer did not have vaccination mandated, you could have an employee that says that the employer knowingly allowed a hazardous condition in violation of OSHA's general duty clause. I think employers can help to mitigate against that risk by ensuring that when employees do come back to the workplace, they have strict safety protocols in place, that everyone is wearing a face mask, that you are not allowing employees to eat meals together at this time. It's something to think about, because everyone's wearing a mask and then they take off the masks, they're sitting across from one another and eating. So you've got certain safety measures in place where you're taking safeguards, or you've got physical barriers up, or you're social distancing. You're taking protocols to minimize the risk in the workplace. You know, you've got your posters up about hygiene, you're providing hand sanitizer, you're encouraging, you know, folks to wash their hands and take all the precautions that the CDC and the public health agencies have instituted or have recommended. So those are some things to help mitigate the risks. Now, some things that OSHA has said. So in the past, when we had the H1N1 issue, the virus, OSHA had said that employers could mandate the vaccine for that. But the caveat is an employee who then refuses the vaccination because of a reasonable belief that they have a medical condition that creates a real danger of serious illness or death, such as a serious reaction, may be protected under the whistleblower sections of the law. So OSHA, just so you know, protects whistleblowers, people that complain about safety and health conditions, protects them from retaliation, from being fired, for instance, for blowing the whistle, for complaining about health and safety violations. So that is something that's something to be aware about. And what I mean by that is that you certainly want to train your managers. It's very important that they understand what the legal protections are for employees, and that they understand that retaliation is prohibited, because that ends up, retaliation claims end up being a big source of litigation for employers. If you have a union and a collective bargaining agreement, you will want to take a look at that collective bargaining agreement to determine whether or not the issue of imposing a mandatory vaccine needs to be bargained over, or whether the management rights provision of your collective bargaining agreement is broad enough that the employer can act without it. You want to, you know, I mean, the unions may be clamoring to have the vaccination in any event. There may not be any type of opposition whatsoever, but you may want to confer with your union rep in any event for goodwill to have a discussion about what, you know, what needs to be done, even assuming your management's rights provision would allow you to do that without bargaining. We talked about, you know, some of the potential risks in a decision of whether you are mandating the vaccine. You know, are you going to, is there going to be administrative burden in tracking the vaccines? Are there going to be employee morale issues? You know your workforce, you know how they will respond to a policy mandating the vaccine, and whether they'll be receptive to it, or whether you're going to get pushback and issues where, you know, employees feel that that should be a decision, you know, that they get to make, and that you instead are finding ways to encourage them and educate them about the benefits of vaccination. I was mentioning, you know, some, you know, for-profit companies have decided to incentivize employees to get the vaccine. And you might want to also consider whether that's something that works for your organization. So now just to talk about some ways in which to help minimize risk. Obviously, I think that you should be distributing and discussing your reasonable accommodation policy and the process for employees to request reasonable accommodation. You may want to consider, you should, keep abreast of guidance that continues to come out about the vaccine. As I mentioned, I talked about the whistleblower issues, potentially. Consider having a vaccine policy, what your policy is going to be. And as I said, if you have a union, discussing that. Be mindful that there could potentially be claims of, if you have groups of employees getting together to oppose a mandatory vaccine, you want to make sure that the managers are not in any way retaliating against employees for organizing, because their rights to get together, engage in what's called concerted activity, to complain about terms and conditions of employment is protected under the National Labor Relations Act. So, so you want to be mindful of those potential rights. And then one other thing to throw into the mix is, are we going to have legislative action? Is the state going to mandate vaccines? Have courts upheld it? There's an old case from 1905, U.S. Supreme Court case that upheld a fine that the city of Cambridge, Massachusetts implemented back in 1905 for refusing to, for those who refused to take the smallpox vaccination. And in New York, we currently have there is proposed legislation that would require the state to administer it and mandate vaccines if it would be safe for individuals to take. The bill would provide for medical exemption, but not a religious exemption. We have not heard from the governor any inkling of an intention to mandate vaccines. So I'm not sure where or how far that proposed legislation will go. So just a few, to wrap up, just a few takeaways. The federal guidance, as I said, it's guidance, it's not the law, so there could be litigation, but the guidance supports generally allowing employers to mandate the vaccination, with the exceptions, as I mentioned, for disability and sincerely held religious beliefs. Asking an employee for a receipt or proof showing they got the vaccine is not considered a disability-related inquiry under the Americans with Disabilities Act. You may want to encourage the use of a third party to administer the vaccine, or if you are encouraging employees rather than mandating it, encouraging them once the vaccine is available to go to the pharmacy or the city-run site and get their vaccine there rather than administering it. And consider whether you want to incentivize employees to get the vaccine by providing paid time off or other incentives. Establish clear policies regarding the vaccine, what you're going to be doing with that. Train your managers. It's obviously not just enough to have a reasonable accommodation policy. You want to train your managers on employees' rights and their rights under the law, and also the manager's obligation. The manager should know who are they supposed to go to if an employee is asking for reasonable accommodation with respect to the vaccination. And so you want to train your managers not just on what the law is, but also what your process is and how employees can access the forms to request a reasonable accommodation. If you are going to ask for proof of receipt of vaccine from your employees, warn them not to provide you any medical or genetic information. Don't ask them information that would elicit information. Don't ask them why they didn't get a vaccine. And remind your staff that you have policies for requesting reasonable accommodations and how they use those, and be prepared to make reasonable accommodations for those kinds of things, and remain mindful of OSHA's whistleblower protections. And as important is training your managers about the prohibition on retaliation, that employees may not be retaliated against. They may not take a retaliatory action in response to an employee asking for reasonable accommodation or otherwise exercising their rights. It's very, very important component that your managers are trained on that. Be flexible in arriving at accommodations. Remote work might be an accommodation, but it may not be an accommodation. And so you want to think flexibly and creatively about what reasonable accommodations could be made for a person's disability, pregnancy, religious practices. Document the cooperative dialogue process that you entered into. You know, when you met with the person, what was the accommodation they requested, your efforts to, you know, to try to find that reasonable accommodation for them. And if you determine it would be an undue hardship to provide it, then document in detail how you came to that decision, because as I said, it's a pretty high threshold in New York. You know, if you have a union, determine your collective bargaining obligations to bargain over whether to impose a mandatory vaccine. What does the CBA say? And, you know, or are your management rights, is it provision broad enough to allow you to do that? I would also recommend reviewing your safety protocols for when employees are coming back into the workplace. You know, the plan that you've set out, the physical plan, how are you going to keep people socially distanced, wearing masks, you know, where are you going to allow people to congregate or not congregate, and really think about reissuing those safety protocols, you know, when you're planning to bring people back into the workplace. But before you bring them back, and then confer with your legal counsel before you make a decision about whether you're going to mandate the vaccine. So that's everything. I'm going to take a look at the questions. Any questions you may have, feel free to ask me either in the chat or you could unmute yourself and ask me the question.
Hi, Lisa. So this is Linda speaking. There's quite a few questions in the chat, so if you'd like, I can read them out to you.
Actually,
Sure.
Lisa, I put them in the chat directly to you, but yeah, if somebody wanted to come on as well, Linda, yeah, either way, because I know, yeah.
But right now I can look at the questions in the chat, that's fine. I do want to say this is general information. It's not legal advice, so I won't be able to provide legal advice on a particular situation, but I'm happy to answer any general questions. There's a question about, can you get vaccinated if you have a severe allergy? I think that's a question to ask your healthcare provider about the vaccine and its impact on allergies to certain types of medicine. You will be allowable to ask about vaccination status. I think we talked about that. You can ask the person, not only, you know, if they have the COVID vaccine, but the proof that they've gotten the vaccine. But again, you don't want to get into any type of medical information. You want to warn them not to provide you with medical information or family medical history information. Under what circumstances requiring staff to be present on site amount to undue hardship? The undue hardship analysis is all about whether providing a reasonable accommodation would pose an undue hardship. That's the question, is if somebody has a medical condition or a sincerely held religious belief that is the basis for them to say, I cannot have your mandatory vaccine. If that's one of the if that's what they are asserting is the reason that they cannot have the mandatory vaccine, then the organization looks at these issues that we mentioned. Would having an unvaccinated employee pose a direct threat? Or would there be, you know, would providing the accommodation pose an undue hardship on the organization? So that's where undue hardship comes into play. It's about the accommodation itself and whether that presents an undue hardship. I'm just looking to see, let me see what else.
I know there were a few in the beginning. Linda, I'm sorry. I know I cut you off from before. Lisa might be seeing the most recent ones.
No, I went up to the, scrolled up
Okay.
to the top. Yeah,
Okay.
so I think I got those.
Yosef, did
You
you
can
want to
also-
come on and ask your question live? You can, Yosef. I know you asked a couple. So if you wanted to come on, you're welcome to unmute and ask your question.
Yeah, hi. So in short, the question is, as long as it's, and there are several times where you mentioned something along these lines, but as long as it's an emergency use authorization, or until there's, until the CDC says things like, oh, we know the vaccine will reduce or stop disease transmission, is there really any basis for an employer to claim an employee's direct threat if they can't prove any of those things?
Well, the New York City Commission on Human Rights has said that based on CDC guidance that COVID-19 is a direct threat. So yeah, what they're going to look at for a direct threat is there significant risk? And you're going to look on, you know, the factors that I mentioned, the individualized assessment, the imminence of the risk, you know, how closely somebody is working with other individuals and clients, et cetera, that would, you know, that would heighten the likelihood that the person is a direct threat. So those are some of the factors that you would need to look at to determine.
So I just want to clarify. So at this point, right, they don't know that somebody who's vaccinated is not a threat. Just but possibly they're less of a threat. So under the law, that still make the unvaccinated person a direct threat because they're more of a threat. Because the vaccinated person is not considered, according to the CDC, a definite non-threat, is what I'm saying.
Yeah, I mean, what we're hearing is that there's you know, 95% with some of these vaccinations in terms of that, you know, 95% you know, probability that the person is not going to get COVID. There's not a guarantee, but I think the idea of, and why there's a conversation about you know, whether employers can mandate this is because the belief is that there is a lower likelihood of someone transmitting the virus or contracting it once they have the vaccine. That's the, and so that there's potentially a lower risk, and that someone who is non-vaccinated, depending on these different factors, the imminence of the risk and all of that, may increase the, you know, the direct threat that this person poses by not being vaccinated and being in the workplace. So I don't know if that answers your question. You're asking if an employer can prove that the non-vaccinated individual is a direct threat, and I think an employer would be able to demonstrate that. In fact, that is exactly the argument the employer would be making, and the reason to either encourage or require the vaccine is that an unvaccinated and non-vaccinated person may present that threat, and that getting vaccinated reduces the threat.
Hi, I have a related question. This is Janice Monger, Staten Island Museum. Hi, Lisa. Very nice to see you. Lisa has helped me before. So on the point, like if we are choosing to encourage employees to get vaccinated, but not mandating.
Yeah.
If an employee then chooses not to get it, can we as an employer effectively institute accommodation, you know, or is that legally, can we do that, or is it potentially a form of discrimination? Like if we decide then, you know, we have shared office space, for instance, right?
Yeah.
So, I mean, can we require that the person, you know, is effectively isolated or restrict interaction, or does that become legally problematic?
So, so you're saying you offer it, but then an employee decides that they don't want to do it. what you can do, and it might be, it might be difficult to, it's a good question. You're not going to segregate one individual, but you might decide that you are, because you have people in the office who are not vaccinated, you are going to reissue your safety protocols, and you're going to ensure that the social distancing and the mask wearing is enforced, essentially, because you're going to have people in the office who won't get vaccinated, or may not immediately get vaccinated, and then maybe over time will change their mind. But in the interim, you're going to just want to be conscious of, creating safety protocols. And it wouldn't necessarily just be where this one person is, it would be throughout the workspace, because that person and other people who may not be vaccinated may be, throughout the workspace, right? And they may be interacting with the public and, and others. So I would say to re-up your safety protocols and think about, what that's going to be. Treat it as though if everybody were not vaccinated, right, before we had the vaccine, but you're bringing people back to work, what safety protocols would you put in place to ensure that everyone is kept safe, both the clients, the public, and your workers and others who are in a shared space who may not be employees, but maybe on premises. So I'd say to just focus on the safety protocols as opposed to singling somebody out.
Thank you.
Sure. I'm just looking to see what else we have here. What other questions?
Candice, did you have a question? I know that I saw it, but now I'm having, if you wanted to come on and ask it, if you're still on.
I could, sorry, yeah, I couldn't find the unmute thing. So I did have a question. I have many staff members that work in different sites, for example, DOE schools. Now, they haven't mandated that employees have to take the vaccine yet, but I just wanted to have some clarification if they do. And that means they're mandating that anybody in the school gets a vaccine. What do I do when I'm not mandating the rest of the staff to take the vaccine?
I think you'll probably have to be whatever policy they issue, and I think you cross that bridge when you come to it. And again, I'm not giving you legal advice. I'm just saying if you're operating in someone else's facility, no matter, not you, but any organization, and those facilities, are putting in place rules, they're going to indicate whether or not, how, if at all, their policy will apply to anyone, operating in that, within that environment. They're going to say whatever their policy is going to be. I think once you have a sense of what the policy is, they'll probably indicate how it's going to impact your staff, if at all.
And any legalities that come along with that would be on my organization's shoulders, not, let's say, for instance, the DOE, correct?
Well, you know what? I don't know what the DOE is going to say in their contract. They might. I mean, you'll be responsible for your employees, and you may have to have a discussion with the DOE about that. I would say cross that bridge when you come to it, because they're going to have a lot of entities that they're going to be interacting with, and those protocols, there's going to have to be a discussion with all those different entities about how that's going to apply to staff coming on site, and what that means. So yeah, I would say cross that bridge when that, if and when that happens, and that it may not happen.
Right.
Now, somebody asked, I'm just taking a look here. Okay, so Anna asked that there are challenges by proper mask compliance, covering nose and mouth fully at all times. What are thoughts about consequences? We are challenged by this. What are the reasonable, appropriate disciplinary responses. So I'm going to say just generally, as an employer, you are able to set, what the rules are to keep your workplace safe. Not only are you able to set the rules, as we were talking about before, OSHA, its general duty clause says that that employers have to make sure that they're keeping their workplace free of recognized hazards that could lead to serious illness or death, right? So as part of your safety protocols or an organization's protocols, you can simply require that because of the pandemic, it's required for people to wear their masks properly, and you can have posters that show that covering the nose. It has to be covering their nose, if people aren't going to abide by the rules, then you can impose discipline just as you would in any other situation where someone is not abiding by the rules. But you can explain by educating them why it's important that they're covering their nose. And even after the education explanation, have a discussion about why they're not doing that. They could be sent home. You probably have a variety of different ways in which you or an organization deals with disciplining employees. And the first course may just be education about why wearing the mask under their nose is not going to be effective in preventing the harm. And also, other people feel uncomfortable or feel unsafe, and you want your employees to feel safe. So I think education is a way to address it. And then if that doesn't work, you enforce your rules. But you should have rules about what your expectation is, and that would be in your safety protocols. Let's see. Okay, Maria asks, for nonprofits operating schools, would this apply to faculty members, or is it just to full-time staff members? I don't think that there's necessarily a distinction in terms of who your employees are. In terms of what the what the EOC says about the COVID vaccine. It's not a medical examination. And so generally, except with the exceptions I mentioned, they say that it can be mandated. That's their guidance. Okay. I'm just looking to see if there's any other, I think I got.
Yeah, I think you did. I think so. I'll encourage, I know that we're at time. Lisa, you've been very generous with being here today with us and answering a lot of questions. I will ask those, if you have additional questions, to please email us, and we can certainly try to see if we can get them answered. We do have some upcoming events where we'll continue this dialogue. Lisa, if you wouldn't mind, I'm going to try to share my screen. So I don't know if you need to
I'm going to stop.
share of yours. Okay. So we do have a survey. Can everyone see our screen, my screen? We're trying out this QR code. Linda, thanks for the prompt. So you can either type in the link to the survey or scan the QR code. Your feedback really helps us plan future sessions for you, our members, our community. We are, starting a new year and new concerns. So we want to hear from you. Please take a moment to share your thoughts on today and future sessions and workshops that we'll be doing. I mentioned in the beginning that we've launched the Staten Island Stay Strong, Stay Safe campaign. It started as an effort to really amplify the collective efforts of a lot of our community-based organizations and partners to keep our borough safe. We were among the highest rates of COVID-19, as many of you know and heard about. So it initially started as people taking a pledge to just wear masks, follow social distancing guidelines, et cetera, and then it became, hey, let's get tested. And so we've been adding more and more material to the toolkit. You can see the link on the slide here, and Linda also, and Frank dropped it into the chat. We're now rolling out a series of video PSAs and photo PSAs about getting vaccinated. So please join us. You can see a lot of our materials and current PSAs on our Facebook pages and Instagram, Twitter, and LinkedIn. So again, we'll share these out with you in the email follow-up, but we really are looking for organizations, individuals, your neighbors, schools. We've had an amazing turnout from youth designing their own materials around this campaign. We've had small businesses that are taking flyers and graphics and posting them on their windows, and some of our CBOs are making posters and putting them out on their lawns. So really, you know, we are trying to hit this issue from all angles. Janice, did you have a question? Okay. Here's an example of the PSA flyer that you can print out from the toolkit, where again, if you're hosting vaccine clinics or hubs at your site, or you yourself are going to get vaccinated, print this out, write in why you're getting vaccinated, send a photo to us, or post it yourself and tag the campaign, SI Stay Strong, Stay Safe. We're still doing the same for testing. Why are you getting tested? We know that regardless of the vaccine, we need to keep doing what we've been doing around the core 4+ getting tested. On February 1st, the COAD and SINFPA, along with our medical ecosystem, is hosting a town hall, if you will, with several of our partners. You can see them at the bottom here. If anyone else is interested in joining us, we're simply asking for your partnership and helping to get the word out about this town hall. It's Monday, February 1st at 10:30. We're planning to have speakers from New York City Department of Health to share the latest updates. We'll be talking about vaccine hesitancy, which follows very nicely from Lisa's presentation today. We'll have our MES co-chairs, Dr. Ginny Mantello and Tina Campbell, sharing Staten Island specific information about the rollout. We started the session today with the understanding and the announcement lately, as of I think yesterday, that currently a lot of the hubs are on hold with appointments. We'll talk about our campaign and the latest information about vaccines. We'll hear from actually community members that have gotten the vaccine. So please join us for that. And the link to register is on here, as well as will be in follow-up emails. Some other sessions that we're hosting as part of SINFPA, the Staten Island Not-for-Profit Association. On February 9th, we're doing a good governance workshop with Nonprofit Westchester on building a positive board and staff partnership. Again, you can register through Nonprofit Westchester, and our members do get a discount code to use that will allow you to participate complimentary. And at the end of February, we'll be having a special workshop with Judy Eisenberg on accessing federal grants. We've heard a lot from members on how local and state funding resources have been tentative or drying up or not secure. And so we've been looking for a speaker to share more with our Staten Island partners on how to access funding beyond. So I hope you'll join us for that. And just a reminder, the College of Staten Island has launched the Staten Island Equity and Belonging Project. About 80 or so Staten Island residents, nonprofit leaders, and other community members are participating in an almost year-long fellowship program exploring equity and belonging in our borough. And a key component of this work is a survey that we've launched to really try to understand the views of our neighbors on equity and belonging in our borough. The link is here and perhaps in the chat as well. Please take 20 minutes to complete the survey. It's going to really help inform some of the work that not only the association and the college, but many of our nonprofit partners are trying to think about in terms of the kinds of projects we want to take on in the coming months. I know that we're at the end here, but we like to end most of our sessions with something you learned today that you'll take away with you. And I appreciate that some of you have already done that. So this is a work in progress. As Lisa said, we're learning as we go along. New guidance, new mandates, new information continue to roll out. So please stay in touch with us, follow us and our partners on social media. And, we're here for you. We have been learning along the way as well with you, and we appreciate all the patience and confidence and trust you've put into this association. And we're here to continue to bring you the latest and best information. So please continue to be our partners, continue the great work you're doing in our communities, and stay well. If you have any questions, we'll stay on for a few more minutes, but we also understand we went a little bit over.
Carmela, can I ask you a vaccine question?
Sure. I don't know if I can answer it, but we'll try.
So do they have any idea about the second dose vaccine since they're running out? I took the first one yesterday, and now I'm thinking I did it for no reason.
Dr. Mantello has joined us. I thought I saw something about this. I don't know, Dr. Mantello, if you have an answer to that question.
I do. Hi, sorry, I was on for a little while and I was listening in quietly. But yes, so my understanding is that each site that is offering the first dose, and I don't know where you got vaccinated, but I'm going to use an example of a federally qualified health center or a hospital. They are, the vaccines come directly from CDC. So every time you get a shipment, it gets earmarked, whether it's first dose or second dose. So everybody that received, and I'm going to use any number, 1,000 vaccines for first dose, they have earmarked 1,000 vaccines for that facility's second dose. It comes in a subsequent shipment, and the city health department usually notifies the practice that these are second dose allocations. So as of now, the second dose allocations have been kept aside. And even though we are very short on vaccines and run out, so to speak, or running out, those are for first dose vaccines. And so the city has canceled or there's 23,000 appointments that are being rescheduled at the various hubs actively. But those are all first dose vaccines, and everybody has been told, do not give out any more first dose vaccines unless you have them in your hand. So if that makes sense.
Yeah, it makes a lot of sense.
Okay, good.
So I got vaccinated at Port Richmond, and that's one of the sites that's being shut down. So
Correct.
do you have any idea what's going to happen? My appointment is my second dose appointment is scheduled to be at Port Richmond in February. So any idea what's going to happen with that? No.
Not yet.
So,
Not
okay.
yet.
So should I keep the appointment or try to get it at a different? Okay.
Absolutely keep your appointment.
Okay.
The hope is that the supply chain will open up within a week to 2 weeks. Again, the city doesn't have any control on this, and really even the state doesn't have any control. CDC and the federal government has to release the vaccines. And part of the reason is that we didn't procure enough vaccines.
Right.
Now, this administration, obviously, everybody knows, has a hefty goal of 100 million vaccines in 100 days. And that can only happen if the vaccine supply chain opens up. I also heard today that there really has been no provision made by the previous administration to have those vaccines in hand. So, again, we can promise we'll try to do this, but if we don't have the vaccines, and that's contingent on Pfizer having enough to give us, so we have to purchase them from Pfizer. We didn't purchase enough on the first round, and Moderna. Now, I did see Pfizer CEO say that they're planning to have, and I don't remember the exact numbers, but 2 or 3 billion by the end, by February or whatever. So they're ramping up production. And then the next step of it, of course, is the federal government has to procure those from Pfizer. So there's a lot of steps.
Right. And have you heard anything regarding the second dose of, like I got the Moderna and I was supposed to have an appointment 28 days later. And my appointment, because of the website said the first available appointment ended up being 37 days later. So is that going to be a problem?
Yeah, so it's interesting you say that. They did not give you the appointment as you walked out?
They did not. I had to go back on the vaccine pod and reschedule, and that was the first available appointment. And from my understanding, you have a 3-day window in that 28 days. So this does not make sense to me.
I hear you, and I will bring that to the city's attention right away. The window really, ideally, and this is CDC is saying 17 to 21 days for Pfizer and 24 to 28 days for Moderna. right?
Right.
But they are not recommending that anybody that gets delayed restart the series. They're saying whenever you can get it, the next dose, consider it as a booster dose, you should take it. So keep your appointment whenever it is and get your second shot. Because right now we only know that one shot will give you roughly 50% protection, but we also don't know how long that protection will last. We need the 2 doses to be able to offer the same protection and efficacy that was portrayed in the data that Pfizer and Moderna have shared. So in order for it to be 95% effective, you have to take both the doses. So there is no recommendation as of right now from CDC to not take the 2 series, even if you're delayed by a week or 10 days or even longer. They're saying whenever you can, take the next dose.
Yeah, and is there anything I could do to force it to happen earlier? Because I really do think that I shouldn't wait if I don't have to.
I mean, I hear you. And I would say that I don't know the answer. If you can try to keep going on it to see if anything else opens up. But the city told me today they're actively working on, again, if you've got it at Port Richmond, the state wants you to go back to Port Richmond. So you're kind of limited to that. And I would not give up that slot, because remember, all the people that they canceled this week, they're going to now try to schedule next week. And they already had people scheduled for next week and next week. So I know there's going to be a crunch to find spots. They are opening up more sites and eventually, and hope to have more infusion of vaccines into the community. But for those that already got it at a site, try to stick to that site and go back to the site. And if you can get an earlier appointment, great. But if you can't, I would definitely keep that appointment and go for your second shot.
Thank you. I appreciate that. I hope I didn't take up too much time.
Thank you, Lisa, for being here. You really, the feedback's been great already on the survey. We will certainly hope to have you back. And thank you again for all the time you've spent with us. Oh, I think you're on mute.
If anyone has any additional questions, they should feel free to follow up with me by email. That's fine.
Excellent.
Lisa at Perlman and Perlman.com. Okay. I'll
Thank
just
you,
put that
Lisa.
in there. Yep.
And we'll follow up and send folks your contact information as well.
Okay. Great. Okay. Take
Thank
care, everybody.
you. Okay.
Have a good day. Stay
Bye.
safe.
Thanks,
Bye.
you too.
Thank you.
Thank you, everyone, for being on with us, for staying later. We really appreciate all the work that you're doing. Feel free to reach out to us if you have additional questions or thoughts. Have a great day, everyone. Be safe.
I'm hanging back in case you guys want to talk after.
Yeah, I was just trying to do the same thing. Okay, I think we got folks out. Yeah. Hi.
Here. Okay.
How are you?
Turn on the light here. I've got this window that's over here, so it's like I've
I like the mock turtleneck and the